Excited for band practice, bro?
Oh man, I'm so excited for band practice. I'm gonna do a few slides today, I reckon.
Really?
Yeah. I love it,
I'd be
man.
really careful with the slides, brother.
Why's that?
Man, you could do really some damage to your knee.
I don't know. I'm studying osteo. We're doing music stuff. I don't think it's very common up in my knee.
Yeah, look, man, I really think you should reconsider, like, you know, sliding in this band practice, man. Like, my dad's done his knee plenty of times. Like, I think you should really be careful.
Maybe, man. But like, see, I know my anatomy and I know the common mechanisms that injure the knee. And the knee, it's not the stablest joint, but there's a lot of structures that help support it. And there's a big one called the PCL. And if I'm going to be sliding,
I swear that was in the ankle, man.
nah, it's in the knee. It's one of the bigger ligaments of the knee.
Okay.
And so it actually comes from the tibia on the posterior aspect of the intercondylar region, touching to the femur up here on the lateral part of the anterior portion of the medial condyle. So again, only excessive force is going to injure that, and I think sliding around at band practice should be fine.
Well, look, man, that sounded like gibberish, but whatever, I'll take your word, bro.
Alright, let's get going.
2 and 3 and 4.
Ow, I've seemed to have really injured my knee. Fire truck. Red door.
What the hell would you do? Do you know what I mean?
Oh man, my knee is so sore.
Oh, and this is deja vu all over again, man. Just wait here. I'll go get some ice. Actually, jump on the bed, man. Jump on the bed. Look, man, I can already see some swelling occurring. I reckon you guys got to see a physio.
No, I reckon we go to the osteo.
Man, what's the difference, honestly?
The osteos are so much better.
Jeez, all your osteos are the same. Come on, go. Don't put too much weight on that knee. So how you feeling, man?
A bit upset.
You're upset.
It's pretty sore. I can't believe I've hurt my knee playing music.
I know, like, you think about it, usually PCL injuries are more in, you know, football, soccer, rugby, maybe even skiing, but
Yeah,
I've never ever heard of it in, you know, in just playing a bit of band. You know, funny you say that. The other day I was reading this thing and it said in 2014 AFL they had 14 PCL injuries, which equal to the ACL injuries.
Really?
It's pretty big stuff.
That's
And also in rugby, it accounts for 5% of all injuries. That's pretty large. So
wow.
I guess yeah, it is pretty common. I guess as common as we thought. So yeah, let's
I'm hoping this osteo
yeah,
can fix me up.
hopefully
Confirm it.
yeah, hopefully there's no surgery required, eh? Oh, so we're here now, so we'll just get you out.
Perfect.
Hello, Kyle.
Hey Doc, how you going? I think my mate's he's hurt his knee a bit, man.
Oh, he's hurt his knee.
Yeah,
How did he do that?
It's been silly, and I jumped on it with a bent knee, so I was sliding during band practice. And
Oh, that's very unlucky. I'll try and get it sorted out as soon as possible.
thanks, mate.
Right, so I'll just get you to bend your knee up, please. So I'm just going to test the stability of your knee. So I see your tibia is moving posteriorly a little bit more than it should. After testing your knee, unfortunately I'm inclined to believe you might have a suspected PCL tear. I'm not sure about the severity of it, and due to this, I need you to get an MRI scan, please.
Okay.
Do you have any questions?
Well, I'm actually studying osteo at university.
Right, that's wonderful.
I'm just wondering how the biomechanics of the PCL ligament works.
Well, the knee is an incongruent joint due to the shallow tibial plateau and large femoral condyles, therefore relying on accessory joint structures such as ligaments and the menisci in order to maintain its stability. During knee extension, Kyle, the femoral condyles roll anteriorly on the tibial plateau until the taut PCL essentially stops further anterior progression of the femur, creating a posterior transitional force on the femoral condyles.
So, Doc, is there any other ways that you can injure your PCL?
As a matter of fact, there is. For example, a ruck contest in footy, or getting tackled below the knees in rugby. Outside of sport, you could simply just miss a step on a staircase.
Okay. So, in my case, how have I injured it?
Well, essentially, you've fallen onto your knee, pushing your tibia too posteriorly. This has essentially strained the PCL ligament too much, which potentially has resulted in a tear.
Oh, that makes sense.
So, Kyle, here's the paperwork for your MRI. I'll just sign this off quickly. Take this to the doctors and come back with the results, please.
See you soon.
Come in.
Hey, Dr. Isaac, good to
Hey,
see you
Kyle.
again. Here's
Thank
my
you.
MRI results.
Oh, you have a grade 3 tear of your PCL.
You're kidding, but I've been able to walk.
Well, it's very common for patients to still be able to walk after rupturing a PCL. However, you may struggle to undertake any kind of strenuous exercise.
Okay, so what does that mean for me in the short term?
Well, in the short term, you might be experiencing symptoms of pain, swelling, instability, difficulty, changing direction.
Oh, okay. So how about the long-term implications?
In the long term, there is a chance you may develop osteoarthritis. You may also experience patellofemoral pain in your knee.
Alright, well, I was hoping to get back into footy. What would you suggest from here?
Well, for a rapid return to sport, I strongly suggest surgery to repair your torn PCL.
Surgery? Are you sure, Doc?
Well, the results of your MRI also show a slight degree of damage to the surrounding structures in your knee. Therefore, I do strongly recommend surgery.
Okay.
So in that case, I'm going to refer you to an orthopaedic surgeon. He is going to take you through the process of the surgery. There you go.
Thanks.
No worries.
A posterior cruciate ligament reconstruction requires a tissue graft to be taken which is used as a replacement for the damaged PCL. It is then prepared into appropriate length for use in the knee joint. Tibial and femoral alignment devices are positioned accordingly, allowing for wire-guided drilling to channel into the bones. The tunnel is then notched to fit the tissue graft diameter. The newly made PCL is drawn through the tibial channel and into the femur. Screws are then placed into the femoral and tibial tunnels to secure the freshly constructed PCL.
Hello, Kyle. Hi, Carl. I was your surgeon.
Hey,
How you feeling after your surgery, mate?
not bad, a little bit sore.
Yeah.
Knee's a bit swollen, but I'm feeling okay.
Yeah. That's completely normal. The surgery went really well, if you wanted to know.
Okay.
The team really brought their A game, so that's good. What you should need to know is the first 4 weeks is very crucial. You may see a bit of swelling, which is completely normal, don't stress out.
Right.
So I can see you've got the compression band, which is good. That can reduce the swelling, but along with a bit of ice for the first 72 hours after surgery is very crucial as well.
Right.
So that is indicative of how quickly you will come back to, say, work or normal daily leisures. So what I'll get you to do is potentially get a hold of some crutches for the first couple of weeks, just to immobilise it, and just a lot of rest, a lot of elevation and sleep, all that sort of stuff. So are you okay with that? Is
Yeah,
that
that's
no
fine.
worries? So also another thing is you'll need to, obviously you've seen Dr. Isaac, yeah? You remember Dr. Isaac?
I remember him.
He's a great offset. He'll go through some extreme measures to get you back, and potentially maybe a personal trainer. Have you got access to a personal trainer?
I don't have one, but there's a few gyms in my area, so I'm
No
sure.
worries. Well, that would be very ideal because, as you know, the PCL is for stabilisation of the knee. So obviously the surrounding structures will help that. So your quadriceps, your hamstrings, your card, strengthening that will be absolutely amazing for recovery.
Okay.
And if you do know, it could take up to 6 to an extreme 12 months, but
Obviously 12 months is if you don't want to get back into sport. So I reckon just do that and you'll be well on your track for recovery.
Okay, no worries.
No worries.
Thank you.
No worries. All the best. If you need anything, just give me a call.
Thanks.